In January 2020, the World Health Organization (WHO) declared the outbreak of new coronavirus disease COVID-19 to be a public health emergency of international concern. WHO stated that there is a high risk of COVID-19 spreading to other countries around the world. In March 2020, WHO made the assessment that COVID-19 can be characterized as a pandemic. WHO and public health authorities around the world are acting to contain the COVID-19 outbreak. However, these times of crisis is generating stress throughout the population. We, the students of Psychology Department, Debasmita Panikar, Fuhar Bandhu, Kavya Kamboj, Diya Kukreja, Harshit Singh Datta, Janvi Bhatt, Stavya Palya, Mahi Agrawal, Palak Agrawal, Paridhi Agrawal, C.H. Sampurna, Sakshi Jain, Rimthim Agrawal, Preksha Lukad, and Shreya Sachdev from N.H.Goel World School are presenting the considerations by the WHO Department of Mental Health and Substance Use as a series of messages that can be used in communications to support mental and psychosocial well-being in different target groups during the outbreak.
COVID-19 has affected people from diverse geographical locations. We see instances over the internet and the world about associating the patients to a particular nationality or ethnicity, thus promoting racial discrimination. Often, COVID-19 patients are called COVID-19 cases, victims, or the deceased. On the contrary, they are the people recovering and being treated for the virus. It's important to separate a person from having an identity defined by COVID in order to reduce the stigma. We should show empathy to those affected by COVID, irrespective of the country they belong to, as they also deserve our love, respect, and compassion.
Many people are spending most of the time watching news, causing them to become anxious and worried, often gathering more than necessary information makes them scared, and there's a need to stop, relax, and take a deep breath. Don't watch TV continuously for hours. There's a lot of tension in the air right now. Don't do it. Instead, relax and take a deep breath, meditate, and stay home, stay safe. Help in household chores, stay with the family and spend time with them. Recollect memories and give time to strained relationships. Protect yourself by wearing a mask and washing your hands frequently for 20 seconds. Call your neighbors and friends and check if they need any assistance or help and provide them with emotional and tangible support. Support each other in this time of emergency. And at last,
one of the most important things is to spread positivity around us during this time of need. We should share hopeful stories of people who have recovered or have supported a loved one and are willing to share their experiences. Also, we should respect the healthcare workers and support the people affected with the virus instead of creating it a taboo and making the situation more difficult.
Feeling under pressure is a likely experience for you and many of your colleagues. It is quite normal to be feeling this way in the current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. Managing your mental health and psychosocial well-being during this time is as important as your physical health. Take care of yourself at this time. Try and use helpful coping strategies such as ensuring sufficient rest and respite during work or between shifts, eat sufficient and healthy food, engage in physical activity, and stay in contact with family and friends. Avoid using helpful coping strategies such as use of tobacco, alcohol, or drugs. In the long term, these can worsen your mental and physical well-being. The COVID-19 outbreak is a unique and unprecedented scenario for many workers, particularly if they did not have been involved in similar responses. Even so, using strategies that have worked for you in the past to manage times of stress can benefit you now. You are the person who is most likely to know how you can de-stress, and you cannot be hesitant to keeping yourself psychologically well. This is not a sprint, it's a marathon.
Some healthcare workers may unfortunately experience avoidance by their family or community owing to stigma or fear. This can make an already challenging situation far more difficult. If possible, staying connected with your loved ones, including through digital methods, is one way to maintain contact. Turn to your colleagues, your manager, or other trusted persons for social support. Your colleagues may be having similar experiences to you. Use understandable ways to share messages with people with intellectual, cognitive, and psychosocial disabilities. Where possible, include forms of communication that do not rely solely on written information.
Know how to provide support to people who are affected by COVID-19 and know how to link them with available resources. This is especially important for those who require mental health and psychosocial support. The stigma associated with mental health problems may cause reluctance to seek support for both COVID-19 and mental health conditions. The N.H.Goel Humanitarian Intervention Guide includes clinical guidance for addressing priority mental health conditions and is designed for use by general healthcare workers.
Keeping all our workers in the healthcare sector protected from the chronic stress and poor mental health conditions during this time of need is very crucial, as this will help them to fulfill their roles more effectively. Ensure that good quality communication and accurate information or updates are given to all the staff. We can also partner inexperienced workers with the more experienced ones, because the buddy system always helps us in providing support, monitoring stress, and strengthening safety procedures. Also, give them proper work breaks and flexible work schedules. Always remember that this situation will not go away overnight. So, stay positive and stay strong. Make sure you make time for yourself as well as others and provide support to one another, because we all need each other right now.
Ensure that the staff working should know from where to get psychological support services. The team leaders might face more stress due to their role, so both the staff and the team leader should take necessary mental help. In fact, the team leaders should be role models for self-care strategies. All the workers working in the quarantine sites should be oriented on how to give emotional and practical support to the affected person using psychological first aid.
Urgent cases of mental health issues should be addressed with same importance than any other physical issue. Training must be given to staff to increase the capacity to support patients mentally and psychosocially. And when time permits, the trained staffs must console and address the patients. People suffering from long-term mental health conditions must take their medications uninterrupted, and sudden discontinuation should be avoided even at the time of COVID-19. Availability of essential and generic psychotropic medications at all levels of healthcare must be ensured.
Help children find positive ways to express feelings such as fear and sadness. Every child has his or her own ways of expressing emotions. Sometimes engaging in a creative activity such as playing or drawing can facilitate this process. Children feel relieved if they can express and communicate their feeling in a safe and supportive environment. Keep children close to their parents and family if considered safe, and avoid separating children and their carers as much as possible. If a child needs to be separated from his or her primary carers, ensure that appropriate alternative care is provided and that a social worker is equivalent with regular follow-up on the child. Further, ensure that during period of separation, regular contact with parents and carers is maintained, such as twice daily, scheduled telephone or video calls or others.
Maintain familiar routines in daily life as much as possible, or create new routines, especially if children must stay at home. Provide engaging age-appropriate activities for children, including activities for their learning. Where possible, encourage children to continue to play and socialize with others, even if only within the family, when advised to restrict social contact. During times of stress and crisis, it is common for children to seek more attachment and be more demanding on parents. Discuss COVID-19 with your children in an honest and age-appropriate way. If your children have concerns, addressing them together may ease their anxiety. Children will observe adults' behavior and emotions for cues on how to manage their own emotions during difficult times.
People with underlying health conditions need to make sure to have prescribed medication at hand for 2 weeks at the least. It is suggested that they have social contacts to provide them with any kind of assistance needed. It is vital that they know and are prepared in advance about where and how to get practical help if needed. For example, having food delivered or requesting medical care. It is important to stay calm and take all necessary precautions to stay safe.
Older adults in quarantine, especially those with cognitive dementia, may become more anxious, angry, stressed, agitated, and withdrawn during this period. Dear family members and healthcare workers, I know you are providing practical and emotional support to them, communicating simple facts in a clear, concise, and patient way, and sharing preventive measures in your own unique and creative ways.
Learn simple daily physical exercises to perform at home in quarantine or isolation so you can maintain mobility and reduce boredom. Keep regular routines and schedules as much as possible or help create new ones in a new environment, including regular exercising, cleaning, daily chores, singing, painting, or other activities. Keep in regular contact with your loved ones, example via telephone, email, social media, or video conference.
As increasingly stringent measures to keep people apart are put in place to contain the spread of COVID-19, more and more people are obliged to remain in their homes. We're all worrying whether we have enough food, grocery, and medication to stay comfortable. But one of the biggest challenges of quarantine will be to our mental health. Recognizing the problem, the World Health Organization has released guidance on how people can protect their mental health during the outbreak. Stay connected and maintain your social networks. Try as much as possible to keep your personal daily routines or create new routines if circumstances change. You can stay connected via cell phone, email, social media, or video conference. Pay attention to your own needs and feelings. Engage in healthy activities that you enjoy and find relaxing. Exercise regularly, keep regular sleep routines, and eat healthy food. A near constant stream of news reports about an outbreak can cause anyone to feel anxious or distressed. Seek information, updates, and practical guidance at specific times during the day from health professionals and WHO websites, and avoid listening to or following rumors.